So it's time for Therapy Works. With me this morning is Robyn Edwards, who's a speech language pathologist and co-director of Therapy Works. Good morning.
Good morning, Carrie. Morning.
Always great having you here.
Thanks.
You know, it's in the season of Carnival, and we're going to speak about a Carnival relevant topic, which voice disorders.
Yeah. So trying to keep all the Therapy Works topics as relevant as possible for Carnival, I came up with the idea of talking about voice. For all of you all, presenters, musicians, hosts of fetes, and then just the general public as well. Our voice is a tool that we need to be very aware of and we need to look after.
Right.
Because like any other tool, if we don't take care of it and we're not aware of how to take care of it, it breaks down. And for somebody who relies on their voice for their livelihood, for their, it's so integral to who we are.
Right.
That I thought it was,
Yeah, it's definitely relevant at this time of year. So tell me, what are some of the causes of voice disorders?
All right, so one of the biggest causes and the one I want to focus on today is misuse of voice, right? That comes when we're trying to talk over speakers in fetes.
Right, so like, the usual thing in a fete, you have something to tell somebody, you go up in the air and you're like, blah, 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 blah. And the question to follow is always, what? And then you have to speak louder.
I mean, and hopefully next week we're going to be talking a little bit about hearing.
Right.
Which is also a relevant speech and language topic for Carnival season. But exactly, you're screaming, you're trying to talk over the music. It's not the best.
And then always, like, when the big performer is on stage and there's a song you really love, you're jumping up and you're like screaming all the lyrics because you want to hear your own voice in the crowd, right?
And then on top of that, there's extra smoking, there's extra alcohol. All these things tend to dry our voice out, for lack of a better, dry our voice out. So we have to make sure that while we're doing all that, we're constantly hydrating, giving ourselves periods of vocal rest. This is very, very important, especially for the performers and the hosts.
Right.
I, as a fetter, can live for 2 weeks without a voice if I go hoarse.
Right.
It's much harder for, Cass or Marshall who are singing night after night after night, right? Or Rishi, right? So we really need to take care of our voice. I mean, other causes of it, there's neurological disorders, things like Parkinson's and ALS can also cause voice disorders. Vocal cord nodules. Nodules are something that you get on your cords from misuse.
Okay.
So when you constantly are misusing your voice, you get a nodule. It's it's almost like a callus on your vocal cords.
Oh, okay, I understand.
Right? And a big one that affects a lot of people is gastroesophageal reflux or heartburn.
Oh, right, okay.
Right? Because that's that acid coming up your esophagus and affecting your cords, your vocal cords.
Okay, that makes sense.
So things to be aware of.
Right. So what are some of the common signs or symptoms of a voice disorder?
So, a persistent feeling that something is caught in your throat.
Right.
You're constantly trying to clear your throat, you're trying to get rid of it, you can't. A strained feeling. Anytime your muscles in your neck feel tense or tight, a scratchy or a hoarse voice. And then sometimes people you'll wake up in the morning, you'll be well rested and your voice is okay. But by the end of the day, from using your voice all day, you're kind of talking like this.
You're right.
Don't do that at home. It's not a good thing. And then other signs might be a lack of volume, where you have trouble kind of getting the volume. So people have trouble hearing you,
voice and stuff,
especially like on the phone and stuff like that.
What are some of the things we can do, or can a speech pathologist do to help to remedy some of these voice disorders, if any?
Yeah. So coming to a speech therapist, every patient will get an individual,
evaluation and treatment plan.
Yeah, because the cause of the voice problems are going to be different for everybody, and that's what we're trying to treat, right?
All right. Well, the most common one, especially in this time of Carnival, as we're talking about, is the misuse of the voice.
Right.
So is there anything that we can do to help remedy or curtail the maleffects of it?
Definitely. Adhering to periods of vocal rest or relaxation. I don't know if anybody has seen, there was a Jimmy Fallon episode that Justin Timberlake was on, and he had to bring his wife to talk for him because he could not speak.
Really?
He was not allowed to talk. He was writing his answers, and his wife was, her and Jimmy were talking. So even big stars, my voice is going, even big stars like that have to do vocal rest. So vocal rest means no speech, no whispering. That is bad for your voice. Definitely no shouting.
Yeah.
Anything like that can put strain on the voice.
Well, it's interesting, as you said, no whispering as well. Like, or even on the other side of the spectrum, that's bad for your voice as well.
Yeah, yeah. It's all about how the chords are vibrating, how they're meeting together to produce that sound, you know.
And again, it says, you said that it could cause nodules when you misuse your voice.
Yeah. So other things that you want to do, you want to avoid throat clearing or coughing. And a big one is you want to drink a lot of water. Okay. Hydrating your vocal cords is essential, especially when we're around a smoke-heavy environment or we're smoking ourselves. Don't smoke. Or or we're consuming alcohol. All of these factors, these are environmental factors that will affect your voice. And so when you're not doing those things, you're out of those environments. Making sure to rest and hydrate is probably the best advice I can give.
All right, well, that is some excellent advice there. Robyn Edwards, speech and language pathologist and co-director of Therapy Works. Thank you for all you've shared this morning. Thanks. And yeah, definitely relevant for the Carnival season. Yeah,
I will say if you have a concern about your voice, seek speech therapy.
Speech therapy.
Seek out a speech therapist. They will be able to really kind of give you the best advice.
All right, awesome. Thank you so much, Robyn.
Thanks.